everybody, welcome back to our YouTube channel. My name is Rashelle and I'm the CEO and founder of Connecting Cultures.
And I'm Erin Rosales, Director of Interpreter Development with Connecting Cultures.
Today we wanted to talk to you a little bit about building your resume and building experience when you don't have the opportunity to get into the field and actually gain that experience. And there's a few things that you can do, but we wanted to break down the steps a little bit so that you can build your resume and be available for hire.
So one of the things that is an important starting point and stepping stone is, of course, completing an initial training program. So in that initial training program, there's a variety of lengths of programs out there. But if we're thinking about just kind of a short course scenario, maybe 40 hours, maybe 160 hours, whatever kind of short course time frame you're looking at, you're going to be getting the foundational components to be able to kind of start thinking like a professional interpreter. Start thinking like are kind of some of those keywords that I want you to think about in there. So you'll get it presented with and exposed to code of ethics, protocols for interpreters. You'll probably get a reasonable foundation for different medical terminology. You'll hopefully have some skills practice for role plays in a classroom setting and kind of get your bearings for the foundational components of what professional interpreters would need to then enter into the profession. Those are very high level and short kind of introductions into interpreting. So that would be one thing to have in your portfolio.
Right, and it's really important to think like an interpreter because that's what gives you the money. That's what opens the door for you to be able to make this a career. I stress a lot about interpreters aren't helpers. So we really want to make sure that we take our training and that initial introduction and really switch a mindset into, okay, here's my role and this is my purpose within that.
So when you've successfully completed a training program, great, you've got this certificate to say you've achieved this particular requirement. And then when you're looking for employment, you're hitting some hurdles because now people have expectations of a certain number of years of interpreting or a certain number of hours of interpreting a particular context or whatever that is. And how do you bridge that gap? And so we wanted to suggest a few ways that you can gain experience, even if you haven't had an opportunity yet to have experience as a paid or contract individual.
Right. So one thing that you can do is take your thinking and start digging in and researching. One of the main things that we want to look at is really understanding a healthcare setting and the different environments, the different concepts, and taking that information and applying it to that.
So how can you expose yourself to a healthcare environment without, having that employment? And so you have to start to think creatively. What are the different educational videos, YouTube channels, websites, especially video-based, because it kind of gives you a way to vicariously insert yourself into different medical concepts and settings. And how do you demonstrate and keep track of the different areas of specialization or the different concepts that you have spent your own time dedicating and studying to, and really truly building a portfolio, saying these are the different resources that I've used to gain knowledge in a particular medical area and how I have worked to improve and develop and strengthen my interpreting skills even in a vicarious interpreting scenario.
Right. And so here at Connecting Cultures, we don't necessarily hire interpreters. We hire people that have the raw skills. And so when you're doing this type of research and getting familiar with departments and areas, you want to be able to explain that because that shows your dedication to the profession. It can replace your experience, and using videos I think is key. Then you can even, if you find some good provider videos or doctors or nurses or healthcare specialists that have tutorials and how-tos and that kind of thing, you could listen to part of the video, interpret it, listen to part of it, interpret it. And so you can start using those practical skills. Even if it's on your own, you're going to get familiar with that vernacular and get your mouth moving and even looking for providers and videos in both languages in your language pair, because that's going to give you the opposite of that. The other thing to think about too is you don't want to get too caught up in every single last detailed word. We're looking for concepts as well, because in healthcare, you're never going to know every word. It's just not going to happen. We've had videos previously that talked about clarification and repetition. A lot of the conversation is dialogue, and it's talking to the patient. You're not necessarily interpreting doctor speak in that encounter. So it's about getting concepts, it's familiarity, it's procedures, it's environment. And so those are the things that you want to look for.
If you're thinking about also kind of getting your groundwork in a particular area, Rashelle, you just really mentioned healthcare is so broad. So try to kind of maybe target and specialize your entry level points. So if you know that there's an area that has a high need in a particular specialization, maybe your language culture pair has a high need of interpreters in endocrinology. So spend a lot of time developing your familiarity with endocrinology,
Right.
using the skills practice, developing your portfolio of glossary lists and other things, having a chance to maybe interview medical professionals in that area, so that when you're sitting down for that job interview, you can demonstrate to the hiring manager what you have done to compensate for your lack of field experience in a formal way. And let me tell you, as people who do hire individuals, that goes a long way to be able to show how dedicated you are as a professional to continuous learning, because you're never going to know every last word.
Right.
So you need those foundational skills to show that you know how to do effective research, to be prepared as best possible for every single scenario.
Right. And one thing that you might want to jump to, and Erin and I were talking about this, is primary care. So pediatrics, general practice, internal medicine. You might put physical therapy in there, but that might actually be a rabbit hole that you want to avoid in the beginning.
Yeah, so, primary care as an area of specialization is just so broad. You might go to an assignment thinking that you're going to be talking about chronic knee pain, and sure, that's part of the topic, but then the list of other medical diagnoses and conditions that the patient is also experiencing come into that conversation. So while you were prepared for talking about knee pain or a knee injury or whatever it is regarding the knee, then all of a sudden they're talking about cholesterol, and now maybe they're talking about, depression medication, and now they're talking about other family members who also see the same doctor. And so that can present an opportunity to find yourself in a scenario that you didn't have an opportunity to prepare for as much as had you had known, that you're talking about endocrinology. Or that you're talking about, physical therapy might actually be a specific scope that might be a good starting place. So thinking about areas of specialization to kind of grow and then add into other specializations into your portfolio.
Right. So in order to gain that experience, you've gone through your initial training, you're familiar with the concepts, you've learned how to think like an interpreter. Now you're going to take that thinking brain, you're going to go and do some research, be systematic about the research. If you start to shotgun it, you're going to be very, very overwhelmed.
Yeah.
And build your resume so that you can take some time, a cover letter, a certain segment, so you can demonstrate your dedication to the field and the research that you've done. And that's a way to gain experience when you don't actually have experience. So we thank everybody for watching. If you like the video, be sure to like it, comment, subscribe, share. It was great talking to you today, and we hope it's a good day.
Take care.